Hello everyone, in today's Explain Why series, we are going to understand a concept which is commonly asked as a Viva question whenever a spirometry comes as an experiment in the clinical lab also. So all of you might have done a spirometry and we will be recording many volumes as well as the capacities from the spirometry. But when we are recording, there are two capacities, that is the total lung capacity and FRC is functional residual capacity. So these volumes, that is the total lung capacity and functional residual capacity, these two we cannot measure it using a simple spirometer. So what is the reason behind it? Let's try to understand. So whenever you are doing a spirometer, it is based on one important principle. What is that principle is? Spirometer is an instrument which can record whatever capacity of air is coming out of the lung. So for example, if I am able to breathe faster, that can be recorded by a spirometer. But the spirometer cannot measure a volume which is left in the lung or which cannot be taken out from the lung. So if I am not able to bring out some volume out of the lung even during a forceful expiration, then the spirometry will not be able to measure that volume. As you can see here, the spirometry cannot measure the volumes that cannot be expired out of the lung. So which is one volume, even with maximal or forceful expiration, I cannot take it out. That volume is nothing but a residual volume. So I cannot take the residual volume out of the lung. So if I cannot take it out of the lung, then the spirometer will not be able to measure this volume. So if I am not able to make the residual volume measurement, then obviously there are other two capacities which have residual volume in its composition. One is the total lung capacity, another one is the functional residual capacity. So these two cannot be measured by the spirometer. Why they cannot be measured? Because again, TLC is nothing but vital capacity plus residual volume. Here residual volume cannot be measured, so obviously TLC cannot be measured. And FRC is expiratory reserve volume plus residual volume. Here again residual volume cannot be measured, so obviously FRC cannot be measured. So that is the reason why TLC, FRC and the residual volume, these three cannot be measured by a simple spirometer. We have special techniques for it to measure. I think you can comment in the comment boxes what are the other techniques which are used to measure this residual volume, TLC and the FRC. I hope it's clear. Thank you for watching the video. We'll see in the next video. Thank you so much.